treated thousands of women with cervical cancer. Cervical cancer is one of the most common cancers in women. Every year, thousands of patients with this diagnosis are treated in hospital. There are no early and sure signs of this cancer, but some alarm signals may indicate cervical cancer. As the Federal Statistical Office (DStatus) announced on World Cancer Day on February 4, 2020, 14,509 women with the diagnosis of cervical cancer were treated in hospital in Germany in 2017. Almost every second affected patient was between 45 and 65 years old. This cancer usually takes a long time to develop. He can make himself known through certain complaints. Breast cancer is the most common cancer with death in women. According to a message from the federal office, a total of 1,570 women died of cervical cancer each year from 2007 to 2017, that is 1.5% of all women who died from cancer. For comparison, breast cancer is the most common cancer with fatality in women with a share of 19%. In 2017, 18,400 women died of breast cancer. Signs of cervical cancer. As the German Medical Association (BAC) and the National Association of Statutory Health Insurance Physicians (KBV) explain on their joint portal patient-information.de, approximately 4,600 women in Germany develop cervical cancer every year. Almost two-thirds of these are discovered so early that the cancer is usually curable. This cancer usually does not cause any symptoms at the beginning. There are no early and sure signs of cervical cancer. At first, indefinite symptoms often appear, such as unexplained weight loss or abdominal pain. Some of the signs that may indicate cervical cancer include: Number 1. Unusual bleeding, for example outside the rule, after sexual intercourse or after the menopause. Number 2. Menstrual bleeding that lasts more than 7 days. Number 3. Malodorous or flesh-colored vaginal discharge. Number 4. Pain in the lower abdomen or pelvis. Number 5. Painful bowel movements or urination. Number 6. Anyone who notices such signs should see the gynecologist. Almost always caused by human papillomavirus (HPV). As the Federal Statistical Office writes, cervical cancer is almost exclusively caused by sexually transmitted human papillomavirus (HPV). In most cases, HPV infections heal themselves. However, chronic infections with so-called high-risk types can trigger cancer. In women, cancer of the cervix in particular is the third most common cancer in the female genital organs. In men, HPV infection can cause mouth and throat cancer. In 2017, significantly more men, 39,289, than women, 14,871, came to a hospital for treatment due to malignant neoplasms on the lip, mouth and throat. Possible other risk factors for this cancer can include excessive tobacco and/or alcohol consumption. In order to prevent the development of cervical cancer in particular, the Standing Vaccination Commission (STIKO) has recommended HPV vaccination for girls between the ages of 9 and 14 since 2007. Since 2018, this vaccination recommendation also applies to boys. Ad.